Welcome to Dime Dive. Have you ever stopped to ask why financial literacy is crucial in today's changing landscape? Let's take a moment to explore this. One significant reason is the noticeable shift in life expectancy. Thanks to medical advancements, people are living longer, healthier lives. In fact, the average life expectancy has shot up from around 60 years to an impressive 81 and counting. That's a whole lot more time to enjoy life's pleasures. But it also means a longer period of financial self-sufficiency. At the same time, we're seeing a contrasting trend. The employable age is decreasing and folks are stepping into retirement earlier. So we've got longer lives to fund, but fewer working years to amass those funds. It's like trying to fill a larger bucket with a smaller hose. And this is where the importance of personal finance and planning for retirement comes into sharp focus. But that's not all. We're also facing the escalating costs of healthcare. It's no secret that medical expenses have been on a steady incline, and they're not just limited to hospital stays or medications. We're talking about nursing care, specialized treatments, and geriatric care too. And guess what? Many of these costs aren't covered by regular insurance. In the United States, for instance, insurance provisions are typically offered by employers, private insurers, or government programs. But the sustainability of these programs, especially with the increasing fiscal deficit and a growing senior population, is a big question mark. And let's not forget about therapy exclusions, co-payments, deductibles, and all those pesky out-of-pocket expenses. Other developed countries, like those in the European Union, have a model where most medical care is nationally reimbursed. But this can lead to budgetary constraints and the exclusion of innovative but expensive treatments. In developing nations like India and China, the majority of medical expenses are borne directly by individuals, with minimal government social security systems to cover healthcare costs. So you see, in this changing landscape of increasing life expectancy and soaring healthcare costs, the need for financial literacy becomes indisputable. It's not just a nice-to-have skill, it's a must-have. The changing landscape of life expectancy and employment age makes financial literacy a must-have skill for all. Among the many costs we face, one stands out prominently: the escalating burden of medical expenses. In today's world, the cost of healthcare has soared to unprecedented heights. This includes not just the expense of medication, but also the costs associated with hospitalization, nursing care, specialized treatments, and geriatric care. Imagine the scenario. You're prescribed a course of medication for a chronic condition. You head to your local pharmacy, expecting a routine transaction. But when you reach the counter, the total cost of your prescription leaves you stunned. This isn't just about the price of pills. It's about the overall cost of maintaining your health. Hospital stays, too, can be a significant financial burden. A single night in a hospital can cost upwards of $1,000, and that's before you factor in the cost of any procedures or tests you might need. Whether it's for an unexpected emergency or a planned stay, those costs can quickly add up, leaving patients and their families with hefty bills to pay. And let's not forget about the costs of specialized treatments. Advances in medicine have led to the development of innovative therapies that can significantly improve patients' lives. However, these treatments often come with a high price tag. They can be prohibitively expensive, especially for patients without comprehensive insurance coverage. Lastly, there's the cost of geriatric care. As we live longer, the need for long-term care services, such as assisted living and nursing home care, becomes more likely. These services can be incredibly expensive, often running into tens of thousands of dollars per year. Yet what's truly alarming is how many of these costs fall beyond the scope of insurance coverage. Deductibles, co-payments, and out-of-pocket maximums can leave individuals shouldering a significant portion of these expenses themselves. In some cases, certain treatments or medications might not be covered at all, leaving patients to bear the full cost. This growing financial burden highlights a critical reality: the importance of being financially literate. Understanding how to manage and plan for these costs is key to navigating the complex and often overwhelming world of healthcare expenses. The escalating burden of medical expenses underlines the importance of financial literacy. In developed nations, the challenge of insurance coverage further emphasizes the need for financial literacy. Let's talk about the United States, where insurance provisions are typically offered by employers, private insurers, or government programs. Medicare, for instance, primarily serves senior citizens, while Medicaid is primarily for lower-income individuals. But here's the catch. The sustainability of these programs, particularly Medicare, is a concern, especially considering the increasing fiscal deficit and the substantial senior population. And let's not forget about therapy exclusions, co-payments, deductibles, and out-of-pocket expenses. These persistent challenges can make the financial landscape feel like a minefield, waiting to explode at the slightest misstep. Now, that's not to say that the insurance scene is all doom and gloom. There are certainly benefits and protections available. However, they often require a certain level of financial literacy to fully understand and navigate. It's akin to knowing the rules of a game. If you don't know the rules, how can you hope to play effectively, let alone win? But it's not just about knowing how to play the game. It's about understanding the wider context in which the game is being played. And in this case, that context includes the rising cost of healthcare and the increasing life expectancy. These factors contribute to the urgency of amassing a substantial retirement fund and underscore the paramount importance of personal finance. And let's not forget that the insurance challenge isn't confined to the United States. Similar issues arise in other developed nations, each with its unique set of circumstances and complexities. This further emphasizes the universal need for financial literacy. So, whether you're navigating the insurance maze in the United States, grappling with the complexities of healthcare in Europe, or trying to understand the financial systems in any other part of the world, one thing is clear. Financial literacy isn't just a nice-to-have skill, it's an essential tool in the toolbox of life. The challenge of insurance coverage in developed nations further underscores the need for financial literacy. Let's shift our gaze to Europe, where the model of healthcare presents its unique challenges. In the European Union, a different approach is adopted. Many of the EU nations operate on a national reimbursement model. This essentially means that the government, or a statutory health insurer, covers most of the medical care costs. It's a system that, on the surface, might seem like a win-win for everyone involved. After all, who wouldn't appreciate their medical bills being taken care of? But as we delve deeper, we realize that every system has its hurdles. One significant drawback of this model is the exclusion of many innovative yet expensive treatments from the national healthcare formularies. You see, in order to manage the healthcare budget effectively, the authorities have to make some tough choices. They need to strike a balance between providing access to a wide range of treatments and maintaining fiscal sustainability. This is where the chink in the armor becomes apparent. The stringent budgetary control often results in the exclusion of newer, costlier treatments. These treatments, although potentially life-changing, are deemed too expensive for national reimbursement. The unfortunate consequence is that patients who might benefit from these treatments find themselves without access under government policies. This is where out-of-pocket payments come into the picture. Despite the national reimbursement model, individuals may still find themselves shouldering a financial burden. It could be for innovative treatments not covered by the government, or for services that fall outside the scope of the national healthcare system. So what does this mean for the everyday individual? It underscores the fact that even in a system where the government subsidizes healthcare, personal financial management is crucial. It hammers home the point that understanding your financial health is not just a good-to-have skill, but a necessity. Even in Europe, with its national reimbursement model, financial literacy is key to managing healthcare costs. Developing nations present a unique scenario that further emphasizes the importance of financial literacy. The landscape of healthcare and financial responsibility looks markedly different from that in developed nations. Here, the majority of medical expenses are borne directly by the individuals themselves. This direct payment system is a stark contrast to the insurance-based models seen in more affluent countries and places a considerable financial burden on the populace. These countries lack what we might consider comprehensive government social security systems to cover healthcare costs. In other words, there isn't a safety net in the form of government healthcare coverage that catches individuals when they fall ill or require medical attention. This situation makes it crucial for individuals to not only understand their finances, but also effectively manage them to be prepared for unforeseen medical expenses. Think about it this way. In these developing nations, when a health emergency strikes, the financial implications can be immense. Without a buffer in the form of insurance or social security, the individual is left to shoulder the entire financial burden. This can lead to catastrophic health expenditures, pushing families into poverty. The lack of comprehensive health insurance coverage also means that preventive health care often takes a back seat. Regular health checkups, early detection of diseases, and preventive treatments can be perceived as luxury expenses, leading to a greater burden of disease in the long run. Moreover, the healthcare infrastructure in these developing nations is often inadequate, with a scarcity of quality public healthcare facilities and a high reliance on private healthcare, which is typically more expensive. This situation further exacerbates the financial strain on individuals and families. In this context, the importance of financial literacy cannot be overstated. It's not just about understanding how to earn, save, and invest. It's about planning for health emergencies, understanding the cost of healthcare, and knowing how to allocate resources effectively. In developing nations, the importance of financial literacy is even more pronounced due to the direct burden of healthcare costs on individuals. In this evolving landscape, one thing becomes clear: the imperative of financial literacy. As we've explored, the extension of life expectancy and the rising burden of medical expenses underscore the urgency of being financially literate. From navigating the insurance challenges in developed nations like the United States to understanding the healthcare models in the European Union, financial knowledge is key. It's even more critical in developing nations, where individuals bear the brunt of medical costs. With the shifting landscape of healthcare and retirement, understanding personal finance becomes more than just a nice-to-have skill. It's about being able to secure a comfortable life post-retirement and ensuring access to necessary medical treatments. It's about safeguarding your future and the future of your loved ones. In the face of increasing life expectancy, soaring healthcare costs, and varied healthcare systems, financial literacy is not just a skill, it's a survival tool. Subscribe to Dime Dive.